Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can also make use of it. Friends, we were discussing about very important topic in pediatrics, that is fever in children. And so far we have completed already 3 or 4 classes regarding the basics. Now, in the last class, I have told that whenever the fever is there, two things are very important. Number one is the place from where actually the fever is produced, because fever is a generalized symptom. Itself, it will not provide any clue for the localization of the fever, isn't it? As it is a generalized symptom. But still, from some part of the body, it is get originated. Tissue injury has taken place at one part of the body, and we need to identify that particular spot. So that is anatomy or place. Number two, environment. Environment we have to consider. Yes, fever is there, but what is the environment? Whether the body is happy looking, whether the child is sick looking, whether the child is irritable, whether the child has got more symptoms, whether the child is very happy. In spite of having fever, the child is happy. So that is environment we have to look into it. So these are the two important things that we have to find out. To find out these two things, now we have to ask important 5 questions to the patient. The first question is, as I told in the last class, onset of the fever. Okay, first question we will ask onset of the fever. Ask a very simple question about the onset of the fever. So what is that question? How it is started. Simply, at least spend a few seconds with the parents. Ask a simple question, how it is started. Or you can say, tell me on the day 1 when the fever started, according to you, how did the fever started? In the sense, whether the fever started suddenly, whether fever started gradually, whether slowly it develops, or whether at once it developed. Okay? Suppose if the mother says, it was a very acute, suddenly child was playing 1 hour back, but suddenly the child started with a fever, then definitely it is of acute onset. If the mother says that from the last 1 day also child was feeling little sick and all, he was not so active, but today morning and also he has got some feverish like feeling. I thought there may be fever, but it was just feverish, but today onwards he has got actual fever. So then gradual onset. So suppose if the mother says that it is acute high fever, or sometime the mother may say that it is a gradual or mild fever. So we never ever thought what is high and or acute fever, or what is low or mild fever. Now we have to think about, suppose the mother says it is acute fever, suppose the mother say it is a mild fever, then what is the cause of this acute fever and what is the cause of this mild fever? How to understand this medically? Now, because the fever is nothing but a response to the tissue injury, and there is production of a lot of chemicals or cytokines which will going to set the temperature at a higher level. Okay, if there is production of more and more cytokines, then the temperature will be set at a new level at a very acute stage, that means very fastly, and this we will call it as a high fever or acute fever. So that means whenever the mother says it's the acute fever, within an hour it happened, that suggests that there is production of a lot of chemicals, lot of cytokine surge was there, because of which suddenly temperature was set at a higher level. That means the tissue injury is more. That means the virulence of the organism is more. When the virulence of the organism is more, it will going to cause more tissue injury at a time, and this produce more and more chemicals, cytokines, prostaglandins at a moment, and because of which there is more and more cytokine surge will be there, and because of which temperature will be get set at a high point suddenly. This is one thing. If the amount of the cytokines are more, it suggests that injury is more, and to protect our body, more cytokines are produced, and as a result the temperature is also get set into a next level at a very brief interval. Lower the amount of the cytokines. Suppose if the amount of the cytokines are lower, then low is the fever, which suggests that injury is not sudden and injury is not at a higher level. That means there is no more amount of the tissue injury took place. If the tissue injury is taking place, that also it is very slowly taking place. It is not all of a sudden. So these two things, whether it is acute fever or it is a chronic fever or it is a high fever or it is a mild fever, this helps to know that whether the cytokines are produced in a large number or whether they are produced in the small number. If they are produced in the large number, it suggests that more tissue injury. If they are produced in less number, it suggests that less tissue injury is taking place. Now, why body produces such a large amount of cytokines? Next questions. In high fever or acute fever, there is production of more and more amount of the cytokines. Why body produces such a large amount of cytokines? Either there are two possibilities. Either there is more destruction of the tissues at the local site, or there is widespread destruction. Now this is very important. Cytokine surge will be more in two conditions. Number one is, as we discussed already, there is more destruction of tissue injury at a local site because of one particular infection. Or if the infection is spread throughout the body, not present, that means infection is not localized at one part of the body, infection is spreading throughout the body, widespread destruction, there also we will have high fever. Okay, suppose if the infection is directly spreading through the blood, definitely it will enter all over the body, isn't it? Spread all over the body within no time. Similarly, therefore we will have acute fever. Anyway, imagine, suppose I will give an example. Imagine a terrible bad event had happened in the city. Okay, some bomb blast or something, okay, happened in the city. Maybe a terrible event in the, okay, a terrible bad event is happened. Now this terrible bad event might have been happened in the whole city, or this terrible bad event might have been happened in the local area of the city. For example, the city areas or some temple areas, like that. Okay, whatever may be the case, it may be happening all over the city at once, or it may be happening at one particular part of the city. Okay, if the incidence is terrible, suppose if it is a bomb blast, definitely the military will come or NIA people will come. Okay, so a destructive lesion like inflammation can occur at one point or all over the body also. When the destructive lesions happens in the one point of the body, one place of the body, for example tonsillitis, it is also a terrible infection, but it's happening in one point of the body. Similarly, a terrible event or drastic infection can also occur all over the body, like typhoids, malarias, or some other autoimmune pathologies. So what I mean to say is, acute fever will be there when there is a terrible event. That terrible event may be localized, or that terrible event may be generalized or widespread. You will have acute fever. Okay, first of all, terrible event causes acute fever. That acute terrible event may be localized or it may be widespread. So acute and rapid onset always suggest acute release of the cytokines at one point, or widespread release of the cytokines at different points. So this is we have to understand. So look at when the patient is having acute, the symptoms are localized or widespread. If localized, look at the symptoms like tonsillitis or pharyngitis, etc. If it is widespread, look at the symptoms like typhoid or some other fevers. So this is how we have to go through the onset of the fever. Rest of the things we will go into study in the next class.